We're going to have our health ministry segment brought to us by Sister Donna Reid. And Donna, we want to thank you for being so willing to do this.
Good morning, and thank you as well, Elder Shirley, for that awesome presentation you did this morning. So good morning, everyone. Happy Sabbath. We're going to go ahead and start the presentation. This is the third and final segment of Water is Health. So we begin with some points that were brought forward in the ministry of healing. Page 146, that pure water is one of heaven's choicest blessings, that God provided it to quench our thirst, and that it is one of the easiest and most satisfactory ways of regulating the circulation of the blood, which is very important. Our blood circulation really mandates the way our internals operate. We also have found water to be cleansing, thirst quenching, and refreshing. The physiological effects that come from using water in a hot form, it expands and increases the blood flow. And as cold, it constricts and decreases the blood flow. We looked at the three useful states of it: liquid, solid, and vapor. And we looked at the hydrotherapy procedures of contrast showers, contrast soaks, and Epsom salts. So today we're going to move forward with more hydrotherapeutic procedures, specifically fomentations, cold mitten friction, ice massage, and steam inhalation. So a fomentation is the application of a hot, moist cloth or towel to a body part. Each hot application is usually followed by a brief cold application to the treated body part, which can be omitted if you're treating pleurisy, kidney stones, or painful menstruation. Benefits to the body include increasing the number and circulation of white blood cells, removing body waste through the skin by increased sweating, relieving pain in the nerves, muscles, joints, and internal organs, relaxation of the muscles, equalizing of the circulation throughout the body, which we already discussed, and shifting the pH balance, which is the acidity balance. We know that an environment of acidity is what creates disease within our bodies. Fomentation indications are for chest congestion, improved function of internal organs, painful nerves, inflammation of muscle joints, difficulty sleeping or nervousness, in which case you would apply mild heat directly to the spine of your client, or to warm a body part in preparation for massage, relief of muscle spasms, relaxation of tight muscles, the production of sweating, and stimulate and increase more white blood cells to fight local and systemic infections. Some of the precautions of a fomentation include, which is times when you would not use it: severe vascular or blood vessel disease, heart disease, poor blood circulation in the legs and feet, which we find in quite often in your diabetic clients, and hypertension. Contraindications include cancer unless under the physician supervision, unconsciousness, appendicitis, neuropathy, areas of a body where the bone lies close to the skin, bleeding or hemorrhage, which is internal bleeding. Cold mitten friction is next. This would be the cold that you would apply after a hot fomentation, which it is an application of cold water with friction from a thick washcloth, a towel, friction mitts, or a loofah sponge. A cold mitten friction is an effective way to stimulate circulation in the skin. It is beneficial to help boost the immune system. Some of the physiological effects are the stimulation of circulation and metabolism. It increases white blood cell activity and the production of antibodies. It's tonic to the nerves and muscles, and tonic to the muscles that cause the blood vessels to constrict and expand. Some of the treatment indications of the cold mitten friction are, again, colds, flu, infections, and reduced immunity or a cough. And it's usually given to complete the heat treatment, to build up the body's general resistance, to improve circulation, metabolism, for generalized weakness and lack of endurance, which some of your clients may experience after long periods of illness or convalescence, and then multiple sclerosis. Some of the contraindications: when the person is chilled, or skin lesions on the area to be treated, which could be spread or worsened by the treatment, which we would find in cases of eczema or psoriasis. The third is the ice massage, which is a local application of ice to a portion of the body. When the entire body becomes thoroughly chilled, its various functions automatically slow down. However, if only a portion of the body is chilled for a prolonged time, its activities are heightened in that region. Some of the physiological effects of ice massage would be blood flow, and this is major, to the treated region. This is greatly decreased at first, but then greatly increased with continuation of the ice massage. And then exercise afterward may further heighten the blood flow. And the person will normally experience 4 stages during the ice massage. First, they will be cold and uncomfortable. Then they may notice a burning or a prickling sensation. Sometimes the excessive cold may cause an aching, but then there's a relative numbness. And you always want to maintain an open line of communication with your clients when using this therapy specifically because of that relative numbness. The treatment indications of ice massage would be a decreased localized swelling, inflammation, pain, spasms after injuries, such as bruises, muscle strain, joint sprains, acute neck or other muscle spasms, acute neck or low back pain, joint pain such as bursitis, or myositis, which is muscle inflammation with symptoms including pain, tenderness, and the possibility of spasmodic activity. Reduced soreness after a deep massage. Contraindications, again, when you don't want to use this therapy: if the person is already cold, if they have been a victim of a stroke, or are experiencing rheumatoid arthritis. The fourth and final therapy will be steam inhalation, which is warm, moist air directed toward the mucous membranes of the upper respiratory tract, which will often help to loosen a dry cough or excessive congestion. The physiological effects of this therapy would be that the mucous membranes are moistened, relieving irritation and congestion. It will also loosen secretions and stimulate the discharge of mucus from the throat and the lungs. It increases the blood flow to the nose, throat, and the lungs. You will usually couple this treatment with postural drainage. And what is that, you may ask? Postural drainage is a way to help treat breathing problems due to swelling and too much mucus in the airway bronchus of the lungs by using either a cupped or a flat hand to apply vibration, percussion, or tapping to various areas of the upper torso. This procedure should be done by one who has been properly trained to perform the therapy or under professional supervision. Some of the treatment indications are nasal and chest congestions to be loosened and thick secretions able to flow more effectively, acute and chronic irritation and inflammation of mucous membranes, tickling or pain in the throat, of nose and throat due to colds, bronchitis, allergies, etc. It helps by moistening those mucous membranes. Coughing warms, soothes, relaxes muscles, and sinus headache. Some of the contraindications would be congestive heart failure, skin eruptions again. Use caution with persons who have asthma, as sometimes breathing hot, moist air may make them uncomfortable. So, some of the points to remember again: always begin your session with prayer. For God is the only healer that we know. And in Exodus 15:26, he tells us, "I am the Lord that healeth thee." Number 2, fully explain the procedure to your recipient before you start it and as you go along, so that they will understand what they may be feeling. Be sure to have them communicate how they are feeling during any procedure. so that you can be on the lookout for anything that may need to be addressed. Specifically, I find a lot of my clients need water during the course of the very warm therapies. So you want to have a cup of water close by with a straw, because you may have to hold it. They may not have use of their arms and hands at this point. So then you frequently monitor the water temperature that you're using when working with infants, small children, and the elderly. And just as a note, I'd like to say that this presentation was not exhaustive and did not cover all diseases, ailments, physical conditions, or the treatment thereof. Please consult a qualified healthcare provider before embarking on any new treatment, that's whether natural or traditional. And always remember, saints, you have the right to get a second opinion. So I'd like to thank you for this opportunity to present again. If you have any suggestions or anything that you might like to see me present on, you can contact me at thedoctor@sbcglobal.net. And happy Sabbath and have a blessed day with the Lord.